We'll get started here. We're right on time, and we're going to have public expression for any item that's not on the agenda. If there's an item on the agenda, then we'll take public expression then. And we are going to get started with the roll call.
Janine Miller. Here. Jan Labordi. Here. Carmel Angelo.
Stepping in.
Ace Barish.
Here.
Ross Liberty is out. Boyd Weir.
Here.
Mark Myrtle is out. Jed Diamond.
I'm here.
Shannon Ryan is out today. Thomas Almond.
Here.
And Donna Machete.
Muschetti.
Ryan's with spaghetti.
Damn it. I know.
See, I told you.
It's all good. I'm here. By the time we're done with this, 20 years from now,
I'm gonna write spaghetti right on.
that's
Okay.
I am here.
All right, so I'd like to thank everybody for being here. We do have three people who, Ross Liberty's out of county. Mark Myrtle, he's a businessman out of Fort Bragg, he's out of town, and Shannon Riley is serving for the city manager. Ukiah, the city manager, is out. And those are three regular members, but they're not here today. We'll start with the approval of minutes and ask if anybody's had an opportunity to review the minutes as submitted.
I have, and I found no errors.
And that's incredible. Not even typos?
Nope.
Okay. So is that a motion?
Sure.
We'd like to make a motion to.
I make a motion that we accept the minutes as presented.
Okay. Second by Dr. Barish, for motion and second. Any discussion? All in favor, say aye.
Aye.
Any opposed? Hearing none, so carried. Thank you very much. And let the record reflect that Carmel Angelo is here. Thank you very much.
Thank you.
Okay, so public expression for any item that's not on the agenda. All we ask you go to the podium and state your name. And it's being videotaped, if you can state your name. And welcome.
Good afternoon. My name is Deborah Clark, and I am a resident of Willits. I wanted to address the committee today on the proposed use of the Frank R. Howard Memorial Hospital as a 16-bed lockdown mental health facility. This site location is wrong for the Willits community in so many ways. After the opening of the bypass in November 2016, the business community of Willits has been struggling. The economic culture has been hard as the community works to define its brand. It should not have to compete with a lockdown facility in the middle of town. This is the heart of our community, where we welcome tourists to the gateway of the Redwoods. A great concern is the proximity of three schools: Willits Unified School District, Spectre Grove Middle School, the Willits Charter School, and a Christian school. Parents and school officials are very concerned to learn of the type of facility proposed for the vacant hospital. I heard it mentioned at last month's meeting that a facility located on Orchard Avenue in Ukiah would not be suited for this type of facility due to its proximity to a school. And yet, the Frank R. Howard Memorial Hospital site is in a similar situation. A school official told me, and I quote, "It was the understanding that the facility was going to be for community mental health services. The impression at the time of voting was that we would have mental health facilities for local people in need. The proposed facility is certainly not that type of facility," end quote. The charge of this committee is to have oversight and transparency of the spending of the taxpayers' money. The Frank R. Howard Memorial Hospital is 92 years old and is 27,000 square feet. Taking on a renovation project of this scope is fraught with the unknown and cannot be accurately projected. It has been stated the floor plan renovation phase will take $11 to $14 million. This amount will likely be the beginning, not the cap. With projected $28.5 million facilities revenue coming from the tax over the next 5 years, will this project take most or all? And it has not been openly discussed as to the ownership of the facility. How much and who? What will it cost to operate and maintain a building of this size? 27,000 square feet is huge, as the committee has stated. So the 16 beds must be filled to make it financially feasible. With an average of 7 Mendocino County residents in need of a 5150 type of care, the other 9 beds will be filled without a county residence. As Dr. Barish stated, the facility would serve those at a dangerous crisis level with escalated problems. once again heightening the risk and exposure for the community of Willits. In the argument in favor for Measure B, it states, and I quote, "Yes, vote yes on Measure B so Mendocino County can construct and operate local mental health facilities and a behavioral health training center so Mendocino County residents suffering from mental illness or addiction can be appropriately diagnosed and treated. Vote yes on Measure B to improve the quality of life for everyone in Mendocino County by providing essential mental health services to Mendocino County residents who need them." End quote. In summation, so many supporters of Measure B did not envision what this committee seems so singularly focused
All
on.
right, tell me time is up, I'm sorry.
Thank you.
Okay, sorry. Should have done that. All right, so, thank you, Debbie Clark. And as you're presenting your comments today, I want to make sure you understand what the Measure B commission for is we make recommendations to the Board of Supervisors. The Board of Supervisors will make the ultimate decision of where a mental health facility will be. And so your words, I appreciate your words. Please save those because when this goes in front of the Board of Supervisors, it's important that your words get conveyed as you said them, but you'll certainly have an opportunity to repeat your words to the Board of Supervisors at that time if that's what the recommendation is. Thank you. Yes, ma'am.
Good afternoon, my name is Stephanie Garrabrandt Sierra, and I'm the new city manager for the city of Willits. I've only been on duty for since April 15th, and from what I was first told, there was some idea of something going on in the old Howard Memorial Hospital building. However, it was only very recently that it came to our attention that this discussion had come to this point in your subcommittee. It came sort of, our legal counsel said, hey, he heard something about this, and he brought it to a staff meeting. I'm a little concerned that that's the way we found out about it, and we've been sort of talking about it since. And I guess the most important reason I'm here is to ask that we be brought into these discussions. We are Willits, and we care very much about the city, and we care very much about patient care and all those good things. However, it's very hard to have a land use discussion and discussion about this hospital without involving any of us at the city of Willits, particularly in city government. We do planning and building, land use, and all of those great things. And I think our council sort of felt that, well, you're going to be coming in front of the city for discretionary permitting. However, our attorney has reported to us that if the county were to purchase this building, you would be exempt from all of those discretionary permits for the city. And this, of course, causes us some concern that we do not have a seat at the table, and we will not be giving any discretionary permits, except for one. I am told that there's a state hospital permit that will have to be complied with. However, I'm going to let you know, because I'm sure that you don't know this, that our building inspector, code compliance officer, was approached by the architect of this project, and he was asking how he could skirt around that regulation so that there would be no discretionary permit involved with that as well. So, which would mean that we would have no discretionary permitting power for the city of Willits. And I think that that's what we're a little bit concerned about. We would like a seat at the table to make sure that this is the best facility it can be. And it's a facility that if it requires mitigations, we can talk about those. And we could talk about the land uses and the zoning and the various ways that this property is used. And I think that that's fair to the city of Willits. And we want to open our hearts to you and arms to you to please come to our city council meeting and make a presentation on what you're planning. I think that that's fair. I think it's fair that you come to us and to the city of Willits and talk about what you're planning and how you're planning it. One of our staff members who is particularly concerned is our fire chief. Our fire chief has expressed that this is a very challenged building, probably more so than you may realize. And he urges you to get in touch with the state fire marshal. And because the state fire marshal has not been contacted to our knowledge, and I think he might have some things to say about this. I'll wrap up my comments by just saying you are welcome to come to our city council meeting, and please give us a seat at the table. I am available at any time. I would love to be a part of these conversations as our residents. Thank you.
Thank you, Stephanie. And Stephanie, I'd like, before you leave, our clerk, maybe should get your email address so we can make
Yes.
sure that you get agendas.
I appreciate that.
So you're fully aware, and Jed Diamond is the representative representing the 3rd District Supervisor at Willits.
And I think that you should make a presentation to our city council as well.
Appreciated the invitation, thank you.
All right, Doctor.
My name is Mills Matheson. I'm a family practice doctor at Bedford Creek Medical Clinic in Willits. I've lived and worked in Willits for 43 years. In 1999, our 16-bed PUF unit located near Ukiah was closed. It was impossible to staff it to meet state standards. I can tell you that from my experience staffing our clinic, that today it is much more difficult staffing a medical clinic than in 1999. Are you sure that you can staff a 32-bed psych hospital in Mendocino County? You may end up with an expensive building without a use and a waste of a lot of money. In 2015, there were 418 5150 holds on emergency room patients in Mendocino County. 273 were at Ukiah Valley, 79 at Mendocino Coast, 66 at Howard Hospital. It was seen that if there's going to be only one Measure B facility, it should be located where there is the greatest need. Ukiah, which has 65% of the 5150 holds, rather than Fort Bragg, which is 20%, or Willits, which has 16%. The number of inpatient adult psych placements varies from year to year. According to the Kemper report, for year 13-14, 171 patients were placed. For year 14-15, 261. That's a difference of 50 or 53%. We also have tremendous variation in emergency room 5150s. There were 107 5150s in 2011, 417 in 2015. A difference of 290%. We need to understand why we have these variations and what we can do to reduce unnecessary hospital placements or, if needed, increase necessary hospital placements. Sonoma County has a crisis stabilization unit where the 5150 holds are stabilized. Of the 5150 patients who go through that crisis stabilization unit, only 25% are referred to inpatient treatment. The rest is at home. Should the Measure B facility be a crisis stabilization unit in multiple towns rather than a 32-bed hospital in Willits? Thank you.
Thank you, Doctor. Thanks.
Hi, I'm back. My name is Gregory Sims. I was here 2 months ago. And Sheriff, you suggested I get in touch with the Behavioral Health Board and present some of the material that I presented to you all 2 months ago. And I did that. And so they invited me to give a half-hour presentation at their June meeting in Boonville. And so basically what I'm here again to talk about is not so much the Willits of Howard Hospital, it's what goes on behind closed doors with people who are very much in need of services, and open doors. And education is much more of an open door type of program where, as I said before, I'm a visiting scholar at Stanford in the field of education, dealing with developmental and psychological issues. And they have invited me to spend another year with them because my project is not done. I'm barely at 300 pages. With the summary of what I'm asking you to look at is find a way to look at the needs of these people. I know you think that the professionals are doing that, but you're all highly qualified individuals. Get to know what's going on with these people and come up with some ideas. Make it your personal vision so that you can not so much concentrate on whether or not you're going to spend $20 million or how many millions of dollars on this hospital. First, get to know these people in some way. And I've seen Sheriff Allman at some of the facilities. I saw him in Santa Claus outfit once. So I know that you have some, I know you have some sense of what these people are about. But I think that the very focus that needs to be included, I'm not saying exclusive, is much more of the detail of what human beings in Mendocino County can receive as a result of the actions that you're taking. 80% of the people wanted you to do this, and so I thank you very much.
Thank you very much, Mr. Sims. Chief.
Hello, thanks for allowing me to speak. I'm Scott Warnock. I'm the Chief of Police of Willits PD. I'm representing the police department as well as Little Lake Fire District and EMS. I'll make it real brief. I'm not going to repeat what some of the citizens and city manager concerns were expressed. Our concern is if there's an increase in calls for service, either the fire department, EMS, or the police department, where the funding is going to come from to supplement our departments. So that's all I wanted to say. Thank you.
Thank you, Chief. Anybody else? Long time no see.
Long time no see. John Wetzler, representing the 5th District, Mendocino County. I see that Ross is not here. I find that it's been a long time with the Mental Health Board. I was with the Mental Health Board for about 6 years, and we've always thought that Howard Hospital would be a great place for a 16-unit IMD. And I still think that. I do appreciate the comments from the city manager that are willing to work with that idea. I think it's an important central spot for the location of an IMD in Mendocino County. I guess just to address one of the concerns, it sounds like people are afraid of what may happen housing or dealing with people in an IMD, a 16-bed unit. I'd like to see the statistics of violence emanating from an IMD in communities throughout the nation. I don't believe those would be, I think they'd be illuminating, and I also don't think it would be a big problem. I do hope that, as the doctor said, we do consider crisis stabilization units throughout the county. This would include the South Coast, Walla, Point Arena. This would include Mendocino, maybe not Mendocino, Fort Bragg. It would include probably, hopefully housed within the Howard Hospital unit, a crisis stabilization unit in that building. And also maybe 2 or 3 here in Ukiah to address the disproportionate demand for the services rendered at an IMD. Thank you.
Thank you, John. Chief Gonzalez. Councilman.
Councilman now, yeah, Jerry Gonzalez, Willits City Council. Again, I'm not gonna repeat what our chief or our city manager said, but I did get a lot of interaction from my constituents regarding this, and maybe because the information's not out there yet, or maybe it's being discussed, but it's discussed down here in Ukiah. And again, not only invite you to speak at our council meeting, but maybe one of these meetings could be held up in Willits if this project continues, so that our local public has a chance to weigh in, and maybe it might alleviate some concerns, maybe it might open up more, but in the interest of transparency, I think that would be important.
Thank you. Good seeing you. Anybody else? Chris.
Hi, I'm Chris Skyhawk. I'm the candidate for 5th District Supervisor, and I'm not here to comment today necessarily on the Willits Hospital, but I do want to comment to remind the Behavioral Health Board that we will need to spread these resources around. I've been talking to people at Anderson Valley Health Clinic and Redwood Coast Medical Services. We would like to see some staffing and some pre-existing facilities that could help de-escalate situations and hopefully avoid crisis and having to send people over to Howard. So I just want to remind the board that we're looking to spread those dollars around, and I thank you for your time.
Thank you, Chris. Derek?
My name is Bernard Kameroff. I live in Willits, and most of what I want to say has been said, but a gentleman just before, a minute ago, said that people in Willits seem to be afraid of what might be coming, and sort of implied that maybe that was not a real fear. And I don't know if people are afraid so much, but in the last 2 weeks is when we've learned about, when we were woken up thanks to the Willits News about what is being planned, and the words of Dr. Barish, that these people are dangerous crisis level. Dangerous seems to imply dangerous. And then when I heard that you've turned down the possibility of Orchard Avenue in Ukiah because it's near a school, because of obviously danger, and yet you're very willing to continue considering a location that's near 3 schools. I'm also concerned that, as was pointed out someone earlier, that Measure B, what we read in the voter pamphlet, is quite different than what we're hearing from your staff now. And our own Howard Foundation, who we in Willis have supported and raised funds for us for years, the head of the foundation has been writing, saying that these people are already in our community and that these are ordinary people, and yet this high security plan with a 12 to 15 foot fence are not ordinary people. And finally, I'd like to say that I've talked to a lot of people in Willis in the last 2 weeks because this conversation hadn't happened before. And I haven't run into anybody that knew it was coming. In fact, most of them really didn't believe me. And I said, this is what they're proposing. And I'm here today because last month, Sheriff Hallman said, this is not one of those government committees that it's going to take 12 months to make up their mind. The word was, we're moving fast paced. And I say the reason these government committees do take time is because unlike a corporate board that just makes up its mind and goes for it, a government committee is responsible to everybody. And as is pointed out, you have not talked at all directly to the citizens of Willits. I think most of them don't have a clue what you're planning for the very center of our little town. And I understand the need for this, but this belongs someplace that's not next to schools, not next to a downtown, not in a little neighborhood area, and I really urge you to look elsewhere to put this facility. Thank you.
Thank you, Rick. Wendy?
Wendy Roberts. I'm here partly because I care about this issue from personal experience and partly because a dear friend was not able to be here. She would have been speaking on behalf of having crisis intervention personnel readily available in all parts of the county. Her son has been hospitalized out of the area, and I think we would both be speaking on behalf of rehabilitating the building in Willits for this purpose. As someone who served on the Historic Preservation Board, I'm almost always going to be in favor of rehabilitating existing buildings. It's more cost effective as a rule, it conserves valuable materials. It also keeps jobs in our county, and it keeps patients close to where they can be in their support networks. So for all of those reasons, I really do support keeping this at Howard Memorial. I am actually deeply saddened by the buzz I've been hearing about the risks to the community of having our family and friends who have mental illnesses served and treated in our communities. I find that just reflecting a lack of sensitivity to our fellow human beings and a lack of realism about what mental health is. Obviously, we need proper security if there are people there who are a danger to themselves or others. But to say that they shouldn't be treated in our communities really just, I'm really on the brink of tears. It's just deeply saddening to me. And I think hearing that was what caused me to drive over here today. And I just want to add that, I spent a lot of years in Palo Alto, very, very different world. They've got, their mental health facility is right next to schools, to a college campus, to a shopping center. And this is probably all over the country. We don't send these people to Siberia because they're sick. So that's my way in on it. Thank you for your service.
Anybody else for public opinion, for public comments? Mr. Mormon?
Yes. James Mormon, MSW. First off, I've been watching you guys for the last few weeks, and this is a very dysfunctional group. For the last 30 years, I've studied group dynamics. You really need to look at what's going on. You got a strong personality as a leader. There's a tremendous amount of peer pressure. You came in with a preconceived agenda, which is to get a couple of people several $1 million. Excuse me, I just ran in here. What I want to get to is I used to be an LPS conservatorship social worker. I spent years traveling around to different locked facilities, and my mandate was to get people out of them and get them back into the community. Just because you have beds don't mean you can lock them up. There's laws, there's people like me with a team of civil rights attorneys that will be knocking on your door every day. These people have civil liberties, and there will be things like independent doctors looking into these clients, and a whole mess of things go on. What we need is services that keep people out, and just keeping them out on the street and preventing them from going into these facilities in the first place. I haven't seen that in the years I've been here. My concentration in college was mental health. I did internships in 3 different counties and then worked for 3 different counties as a mental health specialist. You know, I know what it takes to keep people out of these facilities, and it's services, outreach, things like that, permanent housing. That's about it. Thank you.
Thank you, Mr. Moore. Anybody else for public expression? We'll continue the public expression for agenda item. If there's no more public expression for items which are not on the agenda. All right, moving on. I'm sorry.
Sorry, Carmel Angela, I want to make one comment. I think it's important that everyone understand that this is the Measure B Citizens Oversight Committee. This is not the Behavioral Health Advisory Board. And I think that this has not been the first time in this meeting that there has been some confusion stated by members of the public that have spoken. But I think it's really important that everyone understand we're the Measure B Citizens Oversight Committee. We are not the Behavioral Health Advisory Board. Thank you.
Enough said. Okay, so moving on to agenda item 4A, report to committee from the Rules and Procedure Ad Hoc Committee with discussion possible action. However, the committee is, we're here, we have 33% of the committee here. Muschetti, Riley and Myrtle both are.
I would like to speak, if that's okay.
Absolutely, Donna.
So County Council and I talked this morning, finally, and she gave me the correct language that I need to use and what I need to do. I will be doing that this weekend, forwarding it to the deputy clerk, and she will send it out to all of you, and we can vote on it next month. And I apologize for my ineptness, but I don't deal with county government that often, so.
Okay, so clerk, we'll put that on the agenda for next month. Any public expression on item 4A? Moving on to item 4B.
I have a question.
I'm sorry, Dan, yes.
Yeah, so I'm looking at this. Can you tell us the meaning of the red and blue highlighting?
The red, one of them, she made, this is County Council's
County
response
Council,
to
okay.
what I sent her.
Alright,
And a couple of them she retracted. Is that we're not gonna change them.
okay.
It's the items in blue.
Items in blue are.
In blue
are
is what I did not know about. And so she has told me how to fix that.
Okay.
And I'm gonna fix it and send it off. And I will send it off exactly how I sent it off the first time with all 3 versions.
Thank you.
All right, any more discussion on item 4A? Moving on to item 4B, report out of committee Board of Supervisors agenda summary to amend the Health and Human Services Agency agreement with Lee Kemper and Associates to include a scope of work for an assessment of mental health facility services, organizational needs, and supportive program policy and planning necessary for implementation of the Measure B Mental Health Treatment Act as approved by the voters of Mendocino. Carmel.
Sure. So the next board meeting on May 8th, we will have an item in front of the board that will discuss the progress of the Measure B Oversight Committee and also the status of our recommendation to the board that we contract with Lee Kemper for a needs assessment. Along with that, the Health and Human Services Agency, I believe we may have brought this up at the last meeting, but the Health and Human Services Agency has an existing contract with Kemper Consultants, and we are utilizing that existing contract to begin the process of working with Mr. Kemper as we speak. So I think we're right on target with what this committee has discussed and recommended, and we'll have an item going to the board on May 8th.
Okay, so I know that Mr. Kemper is here. If possible, I'd like for him to introduce himself and associate to the commission and maybe tell everybody who you are.
Good afternoon, members of the commission and the public. My name is Lee Kemper, and I'm the president of Kemper Consulting Group. And with me is my colleague, Jim Featherstone. We are the same consultants who did work on behalf of your county a couple of years ago, looking at your contracted out model for mental health services for the adult services and the children's services programs. As you may recall, we produced a report at that time, and then there was a series of recommendations that were incorporated into that report. Your county administrator, Ms. Angelo, has essentially facilitated us to pick up the work of conducting a needs assessment for the county under an existing contract that Kemper Consulting Group has with the county of Mendocino. And I'd like to basically kind of walk through a little bit about our approach on that. But before I do, I just want to give you a quick overview, a couple minutes, on my background so you know who I am. And also I'd like my colleague Jim Featherstone to do the same thing so you know who these consultants are that are going to be doing this work. So I have roughly 35 years of health and behavioral health related policy and program experience at the county level and at the state level. Previous employment before I established my consulting business in 2012 included serving as Director of Policy for the State of California Department of Health Services. Also, I was an Assistant Secretary for the Health and Human Services Agency at the state level. A lot of the work at that time was focused on the expansion of healthcare, the uninsured, and various component parts of that, including the behavioral health arena. Previous to my developing my consulting firm, I was the Executive Director of the County Medical Services Program, which is an indigent care program serving low-income single adults. Most of those folks have gone to Medi-Cal since the ACA took effect in January of 2014, but before then, they were served by CMSP, and I was there for roughly 12 years as the Executive Director. That was focusing on essentially benefit delivery to low-income people, and there was a whole mental health component of that. So that's my background before establishing my consulting practice. I've done some work with my colleague here in this county. We've also worked together in Plumas County and proposed for them an integrated behavioral health services department. We've also done work in other counties like Sonoma and Yolo, looking at various aspects of the health or behavioral health delivery systems. So that's who I am, and that's basically what my firm brings to this discussion. Mr. Featherstone is a colleague and subcontractor, and I'd like him to introduce himself and talk about his background.
So again, my name is Jim Featherstone. I'm a licensed clinical social worker. I have spent my adult life working with mentally ill people and people who have substance use issues. I worked for the County of Napa for 35 years in the mental health programs, drug and alcohol health services, and child protective services. I was their mental health director and their drug and alcohol director for a good part of that time. I ended my career there as the assistant director for the Health and Human Services Agency. Since that time, I have worked for Napa County in their homeless projects and helped establish their homeless facility, which is actually located in a shopping center, only one in America, doing really well. So I worked in their homeless services program for a number of years. I came back and helped them fill their positions in mental health and drug and alcohol on different occasions. And I continue to work with them right now in fire recovery, like you, that we're still getting through that. So I'm helping with their outreach counseling program for the county of Napa. But I also worked for the Marin County for a couple of years. I acted as their mental health director and then helped them form a health and human services agency where they then recruited a behavioral health director. As Lee mentioned, also did that in Plumas County for them. Currently I'm working with the Partnership Health Plan of California. I think you are aware that they are working with 8 rural counties in Northern California to expand drug and alcohol services under the Drug Medi-Cal Expansion Act. Mendocino County is one of those counties. And we are hoping in September to roll out a continuum of care of services for people of Mendocino and the 8 small counties run through the Partnership Health Plan of California. I think what you're doing in this project is unbelievable, is remarkable. I'm very proud of Mendocino County for putting together a tax program that's going to benefit people with mental health and substance abuse problems, and I hope that we can be of some assistance to that. I think my work, particularly with the Partnership Health Plan, will be of some value in seeing what that continuum looks like for you.
Thank you. So if you will, Mr. Chair and members, I'd like to just briefly outline our sort of high-level approach for conducting this needs assessment. So your initiative roughly presents about $38 million in the first 5 years, and you can use up to 75% of that for facilities, and at least 25% has to go to the operational services side. And then beginning in the 6th year, you have roughly a $2 million revenue stream coming in to support what you've established. I think the initiative itself is pretty straightforward in terms of what it is that can be done. I think our approach in this is to look at the money contextually to the need. So when you get, say, $35 million up front, we want to help you think about how you develop a spending plan that is sustainable over time. Because $7 million a year for the first 5 years is a lot different than $2 million a year beginning in year 6 and thereafter. So what that means is thinking strategically about where you place the resources and thinking about how you can essentially make them extend as far forward as you can for the kind of system that you want. In conducting our needs assessment, we're going to be looking at some pretty basic things to get started with. The first is we have the goals and the objectives for behavioral health in this county. Now we know what the goals and objectives are from Measure B because they're pretty clearly articulated. What we want to do is essentially look at what are the established goals and objectives for behavioral health services delivery in this county, and then look at how these things are integrated into a combined set of goals and objectives that can essentially guide the thinking. You have to know what your goals are and what your objectives are to be able to point in a direction for your services that you want to develop. The second piece is to look at your continuum of care across the substance use disorder side and across the mental health services side. And on the issue of continuum of care, we're going to be looking at that broadly to see where you have services and where there are gaps, and essentially identify the potential kinds of options for making use of resources to fill those gaps to address those bona fide kind of service needs. I'd like Mr. Featherstone to just briefly chat about the continuum of care concept from his experience.
So we'll look at these separately, even though I tend to think of services as integrated. And for the most part, begin to think of mental health services and substance abuse services as healthcare, because that's what it is. It's a specialty of healthcare, but it is essentially healthcare. In California and really across the country, this spectrum of services is available at different pieces in different communities depending on what the need and the resources are. But as you begin to look at kind of less intensive to more intensive, you begin to look at outpatient to residential or inpatient, there's a full spectrum of services for us to take a look at. We're certainly not coming in tied to an idea of a facility or tied to a specific services. We're looking at where can you add to have the greatest impact in terms of the people you're trying to serve. So for example, when you start looking at outpatient services, I immediately start thinking about early intervention. There are people 14 to 18 years old that if you intervene early in their life who are going to have a severe mental illness, it will make a tremendous difference for their lives, their families' lives, and financial for what you spend on them. It's being done a lot of places, and they're having really good success at being able to early identify and treat. It's not magic, but it's really making a difference in those young people's lives. Then you take a look at psychiatric services. You're all aware of that. You know, what kind of medications or assessments are available, how accessible they are in terms of when people need them, and how to get people reassessed and how to support people who are taking medications. These are very complicated drugs. They really require a lot of maintenance to be done successfully. You've heard of people falling off of medications, that kind of thing, but it really isn't magic. It really is assessing, reassessing, body weight changes, other health things that are happening in their lives that need to be evaluated really repeatedly and not just on a once-a-month visit somewhere. You take a look at when someone is in a crisis, what's available to them in terms of a crisis service. So there's outpatient crisis where you go and you talk to people at different times of the day. But there's also, you know, a kind of a crisis residential facility. You've heard something about it. Those are voluntary facilities. People come in, they can leave if they want, but they provide a broad range of services. And again, for the people who've talked about facilities, I've developed crisis residential services, placed them next to a child care center, never had an issue. 12 years, never an issue. Taken that same residential facility, I've put it in a neighborhood surrounded by families. It's where it is right now, never an issue. So these are ill people who need medical services. They have to be appropriately screened and cared for. There has to be appropriate supervision. Doesn't mean they're dangerous people. It means that they are in need of health care. And the health care that is titrated to what their illness is, and that's what a continuum gives you. There's also integrated healthcare services, some of which you already have in your community. Been working for a couple of years with some of your medical clinics about expanding buprenorphine and Suboxone treatment for people who are dying from opioid addiction. They also, a lot of those provide a full range of behavioral health services, drug and alcohol and mental health services, and primary care services. Everybody who has a mental illness should be assigned and given primary care. A lot of what happens to people is they get neglected in primary care, and it affects, of course, our mental health, right? So then there's day treatment, not just socialization. So there is socialization where people go to have something to do during the day who are unemployed and not able to be employed. But there's also ways to enrich those facilities. So there's medication services there's case management, there's somebody to talk to. So what most places tend to have is a portion of that. So there's ways to enrich that, so there's a place for people to go. There's also things called warm rooms or warm lines. So people who are mentally ill are terrified to go to a crisis facility because every time they go, they get locked up. They're not afraid to go to a place that's nice, calm, welcoming, has other people that looks like them there and can be accepting to them. And if they get in trouble at their place or they get in a big beef somewhere, there's somewhere to drop them off that isn't a hospital. So that's another thing to begin to look at. Then there's correctional psychiatric care, some of which you have in your jail right now. How does that work? How does the transition work for people coming out of there? The transitions out of correctional things are really important. Then we start looking at partial hospitalization. Then you can start looking at PUFs, which is a greater, more restrictive environment, all the way to acute care in a psychiatric hospital. Then you have what people were talking about before, an Institute for Mental Disease. That's a long-term facility for people who are conserved, stay for a period of time, and their freedoms are taken away, but they're in a long-term care place. So there's a lot of those types of services, and then you look at employability services all the way to kind of assertive community treatment. That's where a certain high-intensity case management follows people who have had trouble with law enforcement and really enforces their ability to stay in care. There's a care coordination that happens in most managed care plans, and there's navigation, that is helping people get to services when they need services. There's peer support and community centers that are part of this network of services that can be placed in. And then there's supportive living. One of the one of the worst things about being mentally ill is that you're poor. And so having people have a place they can live and call their own, you cannot get well if you don't have a safe place to live. You can't get better. And so supported community housing with resources allows people to stay stable and remain stable. And then when they have an episode and they go away, there's a place to come back to. It's not just a big plastic bag with your stuff shoved in it. You can't get better when you're living like that. Assisted living community apartments is another resource that's available to some people in communities. And of course, case management and intensive case management. There's a full range of services for us to begin to look at when you look at people who have mental health issues. And I'll give you a brief summary of that for substance users. So for substance users, there's everything from the initial assessment and traditional counseling services available to people. By the way, all these things will be coming your way, hopefully in September, when we're able to implement the planning that's been going on for the last 2 years for implementing drug medical services. Then there's more intensive type of outpatient where people get more visits, more time per day. Again, there's an early intervention piece, which most county, your county is involved in already, identifying people early on in their youth. Right now, people don't get treatment for drug and alcohol services until they go to jail now. Well, they start using when they're in high school and middle school. We don't serve them until their first or second jail term. That's when they get treatment. And so bringing all that down to an earlier level is going to make a huge difference in terms of the number of people who seek care later on. Social model detox, so when you want to detoxify from opioids or other drugs, there's a safe place for you to do that. There's also medical detoxification that's going to be available. That's an inpatient thing for people who are in real danger. For example, people who've been using barbiturates or pregnant women who you really want to keep an eye on as they try to detoxify or move to having their child. Then there's medically assisted treatment. I mentioned that earlier. So you go somewhere to see a doctor to get medication to help you reduce or do away with the need for opioids. And then there's methadone maintenance. That whole piece of that, that's called a narcotic treatment program. That's going to be, it's already outreaching to this community now. And then integrated healthcare services. So again, everybody who has a drug and alcohol issue also has primary care and mental health care. One of the things that happens for drug and alcohol people is as soon as they recover from drug and alcohol, many of them have underlying depression and anxiety that's undiagnosed and untreated. Because in our current world, you can either have a mental health problem or you can have a drug and alcohol problem. You're not supposed to have both. Well, you do have both many times. And if you recover from drug and alcohol, you often need help with anxiety and depression. Then there's residential care. It goes from really simple residential care to very intensive residential care. And then follow-up care for recovery services. The other thing that's going to be funded for the first time is residential care. The other thing that will be funded for the first time is case management, helping people move from levels of care. A lot of times when you move from residential to outpatient, people get lost and their recovery gets lost. And then recovery housing, same thing with this population with mentally ill, although it's more temporary. When people come out of treatment, they need a place to recover so they can stay with their gains, and it needs to be a drug and alcohol clean, free environment. Often if they go back to their original home too early, that's another trigger for usage. So those are the continuums from drug and alcohol mental health that we'll be looking at and taking a look at your need to see where the pieces fit together for Mendocino.
Thank you.
So in terms of framework then, that's the way that we're gonna look at the needs assessment. What does a continuum look like? What do the current services look like? Where do they slot in? Where are the gaps? Now, it's important to say that we wanna look at what's also planned because the county has things underway currently. So those get incorporated into this discussion. But what we're, as a part of this, going to want to be able to do is to look at each program, the service population that it's serving, how it's funded, how much is funded, and be able to get good data on utilization. So this means data on what I would call unduplicated users, that is individual people. They might use the service every month, but individual people, and also total volume of services, because then you get an understanding of how many people, and what is the average amount of services per person. When you're looking at, for example, an out-of-county placement for an inpatient facility, we want to know lengths of stay, we want to know unduplicated users, we want to know the cost per hospitalization. All of these pieces are really important in order for us to do the analysis. And I was very pleased by some of the minutes from, I think, a previous commission meeting or board meeting where your contractor, our QMC, said that they're really ready to help provide the kind of data that we'd be looking for. So I really appreciate that because we'll be wanting to work with them and also with Janine and the department on the financial aspects of it. So taking all that together, we're going to try to present a snapshot of what is right now, and then we're going to present for you some recommendations about where we think you should be 5 years from now. And in that context, we will outline for you options for this committee and for the Board of Supervisors to consider to achieve those goals that we're going to help lay out for you from today versus where you would be 5 years from now with these funds. As my colleague Jim said, we don't come to this discussion or this analysis with a particular bias, but for one thing. We want to look across the entire continuum, and we want to help you identify the gaps in that continuum and where you can make investments that we can recommend to you based upon our professional experience will have the best bang for buck for your client and provide the kinds of services that you're seeking for them. I'd be more than happy to take any questions, either one of us, but let me just kind of close by saying we will present our recommendations to you in a formal report that's presented to this committee and also to the Board of Supervisors for consideration.
Sir, if you were to guess of how long it would take to produce this document, what would your guess be?
Our goal for the project is roughly 90 days. I'm going to give myself a window of an extra 30, but we basically are going to try and basically pull the pieces together and do a very pragmatic analysis that is essentially a policy and programmatic driven analysis about how to think about your revenues in the context of need and what you already have and where you're trying to go.
Okay, thank you. Any questions? Jan?
I'm wondering if you will also, in your research, include the court system and law enforcement and probation.
We will be talking to law enforcement tomorrow with the jail commander specifically to talk with the sheriff, but we'll also be asking for data from the various local law enforcement agencies and look to work with, I think, Janine's shop around reaching out to the court system and the probation.
And then the district attorney and public defender's office?
And to the extent that these things all sort of loop together, we'll be
right.
we'll be basically looking to address them in that context. Yeah.
Give me 1 second. Any commissioners have yet?
Yeah, I just appreciate your analysis and report thus far, and I know many of us came prepared with some questions that we wanted specifically to ask of you and your group, so it's nice to meet you here. Look forward to working with you as this moves ahead.
Great, thank you.
Any commissioners have a question? Donna?
Not a question, I just want to make sure that you involve consumers. I know that's probably not the politically correct term anymore, but that you include consumers in your evaluation because they know where they've been and what we've done for them or haven't done for them.
Thank you actually for making that statement because that is a point that I wanted to make as well. We're talking with a variety of key informants, and we have a handful of interviews that are going on today and tomorrow. In fact, we'll be meeting with the chair of the Mental Health or Behavioral Health Advisory Board and perhaps some selected members after this meeting to get feedback. But also, we'll be reaching out to a variety of other parties in the community, and we'll look to work with the BHAB to get some names of consumers to talk to. Both on the mental health, that'd be great. Both on the mental health side and the drug and alcohol side.
Perfect, thank you.
Thank you.
Donnie is our representative representing NAMI, and so she's
Perfect, and I'd be happy to.
Are there any other commissioners that have questions? All right, so this time I'm going to open up the public comment. If you can go to the podium, Doc, and
Just a simple question. Will you be looking into the staffing issue, which staffing these facilities and the problems involved? Because that seems to be a big problem.
Yeah, I mean, you're talking about like a PUF?
A PUF for...
Yeah. Well, I think, in an analysis of a facility, you have to make the facility operational. So that means that there's some sort of break-even point around what it takes to actually make a facility work. So if you had a 16-bed facility, I'm not going to tell you I know the number, but X beds have to be filled on an average basis in order to make the numbers work. That means that the total cost of that is what goes into making the facility work. That total cost then goes into how much you can pay for over time. And I think that we're going to be looking more at the need side of the equation around where does it fit in the unmet need piece, as opposed to how much does the facility specifically cost and how should that be staffed. That's a pretty detailed analysis, and there are companies that run these, there are other organizations that can actually cost those things out. We would probably be looking to the research that's been done on those, as opposed to doing any of our own research or work on our own.
Many of us are worried about do we have the manpower in Mendocino County to staff a 32-bed hospital.
Well, I think,
we
and
failed before.
I think it's
So you can ask me the question, I'll ask. I'm just trying to go by the rules. So
I think the question is just, can you staff it? That is always a present question, and one that I think would need to be discussed in further detail by this body as well as the Board of Supervisors.
Any other public comment?
Yeah, I have a question.
So, I'm sorry, Mr. Kameroff raised his hand first.
Just in listening to Mr. Kemper say that there's just so many beds that have to be filled in order to be able to pay for the cost of this facility. If that means some of these beds are going to be filled by people who are not from Mendocino County, then my question is, are we stepping away from what Measure B said we were going to do? And therefore, is this really something that should be allowed?
So I'm going to answer that by saying, at this point, the purpose of a needs assessment is to talk about the needs, to assess the needs of Mendocino County. And it's for all the citizens and the commission to look at, to say, this is the needs of Mendocino County. It's not a business plan. It's to say, this is what we need, based on the history of where we've been for the last several years, based on the Department of Mental Health and Redwood Quality Management's numbers and so forth, of where we've already been, and projecting out to where, my hopes is projecting out where we're going to be in the next 20 years. So in 20 years, we don't say, why didn't we think of that? Any other public comment? Mr. Marmon?
Yeah, I read your assessment you did a couple of years ago on the ASO model, and I'm really impressed with your assessment and your recommendations. It wasn't part of your official recommendations, but you did on at least three different places mention the need for some kind of financial audit into the ASO model, where our money is going. Now, I would hate to see good money, being spent following bad money right now. I was just wondering, are you going to maybe look at that to see?
Mr. Chair, it sounds like the question is, are we going to be looking at the financials of the ASO model? No, we won't be doing that, because that's a deep dive.
It needs to be.
It's a deep dive that's not really in our skill set. You would really need some accountants and some other folks that are looking at that. I think the issue of expenditure plans and reporting and audits are all a part of public contracting. So I'm presuming that the county has existing requirements for that. And so for your contractor, I'm sure that those kinds of documents are being prepared and submitted. So I would encourage you to perhaps avail yourself of those public documents first. And second, if there's a need for that, then some type of an assessment, then that could potentially be done by another entity.
Again, I just
concerned that Libby?
Yeah, Bishop Baumann, I just wanted to share that whatever needs assessment is being done includes talking to clients or informants or whatever the word is on the coast, including all parts of the coast and Round Valley, not just the experiences of people who are closer to services.
That's my intent also. Any other public comment on this topic? Public expression? All right, any other commissioner questions? Thank you very much. We look forward to working this. So now item number 4C is we just segued into it, the needs assessment discussion and possible action. I think we've covered it with 4B, but is there any other comment regarding the needs assessment, discussion and possible action? Thank you for attending. Jed?
Yeah, you had asked the,
Wait, hold on one second.
yeah.
So conversations can go out in the hallway. We welcome them. Thank you. Okay, Jed.
Yeah, the chair had requested that the committee bring questions that we would like to see.
Right.
How do you want those handled? Do you want, I wrote them out, you want them turned in or spoken, or how would you like those questions to be addressed?
Okay, so that was what this was. We were hoping you would ask questions directly to that. However, if you would like to get those to the consultant, then that's the way.
Is that where you want to?
Yeah.
To the consultant?
Right.
Sure.
So can you share
Yes.
those?
Yeah, it's the first I've seen them, so go ahead.
Sure, I thought it was supposed to be shared
Yeah.
with everybody. Do you want me to just read these?
Yeah.
Okay. So I said, I believe there is a general consensus among those knowledgeable about the need for mental health services in Mendocino County that our first priority should be the development of a residential facility or facilities to address the needs of people who have become mentally ill. The overall questions we're hoping to be addressed by Lee Kemper include an assessment of mental health facility services, organizational needs, and supportive program policy, and planning necessary for the implementation of Measure B as approved by nearly 84% of the voters of Mendocino County. The specific questions I have include the following. If the answers to some of these questions are available already by staff within mental health services, I would request this information be given prior to having Mr. Kemper begin his study. But here are the questions. Number one, the number of people who have been put on 5150 holds in Mendocino County as a danger to themselves, a danger to others, or gravely disabled. That is, unable to care for their basic needs, kind of what gravely disabled means. Two, the percentage of the total in each of these three categories. The number that, number one, are a danger to themselves, a number that are a danger to others, and the numbers that are gravely disabled. So we can have an idea of how those split out if they're different. Number three, the number of people in these categories who have these problems and need service and treatment but aren't receiving it. That is, people being seen in the jail or emergency room, the hospitals, etc. Number four, number of people who are presently being sent out of county to other facilities, since there are not adequate facilities available in Mendocino County. Five, the advantages and disadvantages of treating these patients in an upgraded facility at the old Howard Hospital site in Willits. Six, exploration of the need for a facility or facilities in other parts of the county. Are there other suitable sites that could house such a facility? Seven, since there's a need for care ranging from 72 hours for evaluation and stabilization, up to 30 days or for longer-term treatment, and treatment that might last longer than 30 days, what services should be rendered within Mendocino County, and what services would continue to require sending Mendocino people out of county. For instance, those that might require conservatorship or longer-term treatment than we might be able to offer here. Eight, since mental health services still carry a great deal of stigma and fear, what are the actual risks of having patients in a locked facility in Mendocino County versus the worries and fears that some people have about the mentally ill being in our neighborhoods? Nine, what kind of education might be needed to reduce people's fears while still protecting the members of the public? 10, since continuity of care is important, what facilities and services already in place that would be resource of referral into a local residential facility, and what facilities and services are available to follow up after someone leaves the local facility? 11, what would be the advantages and disadvantages of having people in our local facility who are residents of other counties who might need care? 12, how would we ensure that people who would be returning to their county of origin for further care and treatment rather than being discharged into Mendocino County, if that's not advisable? So that's my questions.
No.
First of all, I like your questions. I thank you for making up that list. I have some similar questions that I've debated whether I should be asking Lee Kemper. I mean, they're not specifically tailored to what he's doing. One additional question I have, and I don't know quite exactly where to fit this in, but it seems like it's part of the discussion, is that one of the facilities that's specifically mentioned in Measure B is the psychiatric health facility. And I think in planning this, making and evaluating some of these questions, it would be helpful to have to know who was going to be operating this facility. I don't think that's been decided, and I wonder if it might be useful to decide that along, in parallel with deciding where this facility is going to happen and how it's going to be constructed. I mean, it seems to me that whoever's going to be operating it may, at this point, have a say in what's happening and enter the discussion about what happens around psychiatric health facility hospitalization. And I don't know if that's up to this committee or if it's up to the mental health, behavioral health department, but it seems like it would have a certain amount of utility to know who's going to be operating it and have them participate.
Let me be the first to answer on that one, and we're in our fourth meeting of the Measure B Commission. And one of the purposes of the needs assessment, which we've gone to, is obviously to assess our needs. And once our needs are assessed, then I think that the county would be at an advantage to start putting out some kind of survey or request for proposal for interested entities. There are obviously not-for-profit entities that respond to RFPs. There are for-profit entities that respond to RFPs. And I understand the questions that we're getting, but I don't think we're gonna get to the answer until we at least get to the point of knowing what our needs are, and then say, all right, so if these are our needs based on fact, based on the documents that we have, this is not opinion driven, this is gonna be numbers driven, then we can say, all right, now we can put this out and say, what is this gonna cost us to have a company run this? Does that make? So I think we're gonna get to that eventually,
Right.
but I don't know if now is the time to do it, but that's my.
Well, I guess, that brings me to another question. I mean, as I said, we have the training center and the PUF in the measure itself.
Right.
So does that also fall into the realm of the needs assessment, or is that something separate?
I think it falls into the realm of the needs assessment, yeah, absolutely. So Carmel had her hand up first.
Thank you. This meeting is really interesting in that trying to do a process is very difficult because there are so many assumptions. There are just so many assumptions. And that's exactly all they are, is assumptions, because if we had the answers, we wouldn't have decided to even do a needs assessment. And then I really believe that to try to keep this very simple and a very clean process is that we do exactly what we're saying, which is we start with this needs assessment. That's what we're seeing today. There haven't been any decisions made. Everybody has their own opinions, but there haven't been any decisions made. There hasn't been a location established. There hasn't even been, we don't even have a needs assessment that says exactly what the gaps in service are. I mean, we're like 5 miles down the road and we are just at square one. I think that Dr. Barish's question is a really good question, and I would like to address that question from a county process perspective, that until we know exactly what services the needs assessment will reveal as far as what we have, what we don't have, which direction we should be going in, then I don't think expanding the people at the table at this point would be helpful. I think that what Mr. Kemper is going to do will be speaking with our stakeholders along with clients and such. So I think some of that may be picked up just in his process. But once we get to a point of having recommendations and then they come back to this commission, and then this commission then decides which recommendations the commission would like to move forward to the board, then that's when we actually get into process. And I'll just say one more thing, which is really based on what the sheriff said. We know within a government contracting process, when we're talking, if we're talking about any facility, whether it's a training center, whether it's a 24-hour facility, whatever, we're talking about something that's probably going to be a few $1 million. We will need to do a county contracting process, a competitive process. We'll have to be very careful with that as to who's involved, who's at the table, who's helping to develop that. So that is way far down the line right now, but I really appreciate all of the questions. They're all good questions. It's just that, we're at ABC, and I feel like the rest of this room is past Z, and we are right here. This is where we are today, so thank you.
I'd rather be ahead of the questions than behind the questions, and so we're good. Dan?
Thank you. I just wanted to piggyback on the comment about planning. And I know that obviously our discussion of the Howard Hospital at the last meeting stirred up a lot of concern in the Willits community. But this goes along with some assumptions. In the ordinance, it doesn't say that the facility being developed is a psychiatric health facility, which is technically a PUF unit, which is what we had before that failed. It says a psychiatric facility and other behavioral health facilities, which opens it up to discretion and to fit real needs instead of saying this is what we need, this is what we need to do.
I agree. Doctor?
One other question, and this I debated with myself as to whether this is the appropriate but I truly appreciate the comments that were made today in the article that Bear wrote for the Willits papers. I think that it's an extremely important discussion to have as to the safety of these facilities, and in that connection, I mean, all any of us can do is to cite previous experiences, and I think that the discussion is one that absolutely has to be had, and I'm happy to have it sooner than later. And I wonder if it's a fair question to Lee Kemper as to, as an independent observer, if he knows of any statistics about the safety of the surrounding neighborhood for PUF units.
I think it depends upon the facility, the operator, all those kind of things are really important.
I don't think there's been, that I'm aware of, any big demonstration of safety issues around those facilities. But a lot of those facilities are in pretty rural areas, and so they're not big urban areas. Down in the Bay Area, they are in urban areas. And I don't think they've had big issues there that you wouldn't see in an ER room, an emergency room, or any other kind of emergency type facility. We got people coming in who are distraught. And I think the same thing happens with drug and alcohol facilities. If you look at social model detox and residential care, I think there's always areas concerns about that, but I think if they're handled well, they're very, very minimal, at least the ones I'm aware of.
One other issue, that has some bearing on this is that I understand the sheriff had a grant to build a facility next to the jail I'm not sure exactly what the designation, but those are the most violent that are not manageable outside of a jail location. It seems like that would take a lot of the pressure off a PUF unit in the community.
Isn't that a jail addition?
No, so the sheriff's office received a grant from the state after AB 109 was releasing inmates that had been in state prison, and now they're the responsibility of county jails to house. And so we've seen an absolute uptick of inmates who are violent and inmates who are mentally ill. So the wing at the jail, which we're in the process of starting, will be specifically for inmates, not for mentally ill standalone people. It will be for people who are inmates who are mentally ill and inmates who are dangerous to other inmates and who are dangerous to staff. Well, it's not a puff unit at all.
Just one.
Yeah, Jeff.
Yeah, I just wanted to also respond, as Ace did, to community members who have come today, particularly from Willits. Some of them I know have left, but and I appreciate members of the press that are here, because we've, as a committee, really made it a priority to get as much information out as we could, to post the agendas everywhere we could, minutes, out to everybody. And I know that's doesn't mean that everybody's going to be able to have access to them, but at least in terms of Willits, as I'm the representative, as most of you know, from the 3rd District, it includes Willits. But I've met with anybody that's called me. I've been getting a lot of calls, more in the last week or so. I've spoken to members of the press and given, information. I wrote, I'm sorry Stephanie wasn't here, but I had sent a request to the city council to say if the city council would like to meet with me or members of the committee, we'd be happy to do that. So I'm glad that they were here and they voiced that directly, but I just wanted to let everybody know that we've reached out to them and we just haven't connected. It's, everybody's busy. So I'm sure we will do more of taking Stephanie and the other city council and other members of certainly the Willits community and the area that I represent, 3rd District, to meet with the people, to share, to listen to you, here at any of these meetings or us coming to where you are. And I know that's going to be a continuing dialogue that we will all have together. So I'm glad you're here.
Shannon Riley, who sits on the commission, but she's filling for the city manager Kai today. She did send an email with 6 questions. I'm really quickly going to read up questions. The questions are for Lee Kemper and Associates of how many facilities are needed if more than one will be located, how many beds are needed, will children be served, how will existing services be connected to the facilities to ensure there's no duplication of services, what existing resources can be leveraged to ensure sustainability, and how will success be measured. I think these are all questions that we have that we'll just make sure you get a copy of before you leave today. All right, so any more questions regarding agenda item 4C? Any more public comment on item 4C? And to remind you what 4C was, it was the needs assessment discussion and possible action. Any public discussion? Okay, well then Dan.
I think what this reveals is that there's a great need for education to eliminate stigma against mental illness. And I think that is something that, this commission could take on as a personal project to find a way to reduce that stigma so that mentally ill people are seen as ill people and not some monster that is gonna, do something really bad.
I agree, and I don't know if anybody's been able to crack the nut of how to get that education out. I was in front of the Board of Supervisors yesterday, and as I said, just a minute please, Mr. Farmer. It's not illegal to be homeless. It's not illegal to be mentally ill. Not everybody who's mentally ill is homeless. Not everybody who's homeless is mentally ill. However, there is a segment that gets in the middle, and that percentage certainly puts out the public perception of everybody who's mentally ill is homeless, or everybody who's homeless is mentally ill, and they're not safe people. So I agree on that, and I don't know what the thing is. I've closed public discussion. Mr. Marmon, you raised your hand if you want to make it really quick.
Just real quick, that 12 to 15 foot high chain link fence does nothing to help stigma.
All right.
That's not a very good idea.
Any more public comment? Okay, thank you very much.
Just to back up what you're saying about the need for education, Ms. McCourtney. Curriculum and method are items that are often left out of mental health. And we could certainly have a much more robust program if those two qualities of education were infused into all programs. So I'm very much in support of that.
Okay, and I'll go along with Carmel's discussion, reminding people what our role is to give recommendations to the Board of Supervisors how the dollars are going to be spent. All right, so we're going to do a report out of committee members. Janine.
I've been just working with Lee Kemper's group.
Okay, thank you very much. On another project or this project?
No, this project.
Okay. Jan.
We had a behavioral health meeting in Coblo this month. Our next meeting is in Willits, if anybody wants to attend from Willits. And the second part of our meeting will be a tour of Howard Hospital, just to see what it is. One of the things that happened at our last meeting in Coblo was that Frank Tuttle gave a slideshow. Did you walk out of that before that? Of the history of the genocide in Coblo to show the trauma and how it permeates intergenerational trauma and affects mental health today, their mental health today.
So can you give the date and the time and the place of the rehab?
Of which one?
For, you said you're meeting this next month in Willits.
This month, next month, or not? May's meeting?
You just said you were gonna meet.
Yeah, May 16th.
Okay,
May
we're gonna
16th.
It'll be May 16th at
10 o'clock.
at the county where.
Yeah, at Whisk.
Anything more, Jan? Carmel?
Sure, so we'll need a decision as far as who will be presenting on May 8th to the board. One of the items will be, it'll be update to the board on the Measure B Citizens Oversight Committee. I guess approval of the capital contract, we'll probably have to do that. And so this committee will present, you as the chair could present, or you could have the whole committee there, however you want, and then we'll need Dora to work with the clerk staff to get the agenda summary and the item on the board agenda. Because the item's coming from the Measure B committee, it's not coming from me or the sheriff, it's coming from the committee.
And making sure everybody knows this is not a presentation to make recommendations of where it should be or where it shouldn't be or anything.
No. This
is merely a needs assessment presentation to the board to say we're moving forward to the needs assessment.
It's an update, this is what the commission's done the last 4 meetings, this is our recommendation to move forward with this, this is the contract we want to move forward with, that's it.
Great, okay. Doc.
Nothing.
Wade?
Yeah, so just to follow up Carmel's comments, as you know, the tax is in effect starting April 1st and is currently being collected out in the community. And those funds will then go to the state and eventually come to the county. We're looking at the end of June, 1st of July to receive our first deposits of money. So another item maybe to take in front of the board is a possible budget that we want to present in the budget book for the next year, so that we're transparently showing, what the revenues and expenditures may be coming down the pipe. So.
Right. I have a question regarding that. The Voter Pass Initiative also speaks about an annual audit, an independent audit. Where do we go on that?
Yeah, so the County of Mendocino does engage with an independent outside auditing firm, and they are instructed to test and drill down into the various funds in the county and make sure that everything is being properly expended as to the government code. And so we're prepared to have that work done during the next audit session or when we start getting funds to audit.
Okay, and our first chunk of money will come in at the end of the second quarter, right?
Yeah, so it probably won't hit our books till July, probably.
Do you have anything to report?
Yeah, just a couple of added things. I've been getting calls, as I said, more often in the last couple of weeks from some citizens in Willits concerned, and I think one of the concerns I heard from a number of people was there was a misconception, I think, on what some people had either thought or had assumed that at this meeting today that decisions were going to be made about the Howard Hospital facility, that it was going to be approved or recommended, and that many things that were of concern, like a big fence or a wall and the people that would be there. So I just want to add to what Carmel was saying, that I think some people kind of got ahead of certainly where we are, and I tried to reassure people that, you know, this is a process, no decisions were going to be made today. So I've been fielding calls, I've been talking to them, anybody from the news media that have asked about what we're doing. As I said, I reached out to the city council and the city manager. I met with Mika Ferretta, who's, I think, Mika, who's the rep from Mental Health, or the Behavioral Health Advisory Board. Yeah, so she and I talked about what she's doing and what the board is doing and what we're doing as part of this board. So, you know, there's a lot of complexity and there's a lot of information that needs to get out, and I think we all have a, you know, a responsibility, and I'm very open to sharing what we can and trying to keep everybody on the same page with what we're doing so they know and we know what the community's needs are. And I agree with you that getting information even or concerns, even if it's way ahead of where we are, is better than finding concerns out after decisions have already been made.
Right, and just a reminder, we've all gone through Brown Act training, and so we're a Brown Act commission that we don't meet behind closed doors and make deals. I mean, everything is as open and transparent as can be. Donna?
Nothing, just myself and another NAMI board member toured Howard Hospital, so we have seen that, and that's all I have to report on my end.
Okay, I have nothing to report. Thank you very much. It's 2:27. We are over. Thank you. Thank you for taking the time to attend today. Thank you very much.
Give me $20.